Chronic inflammation can have a significant impact on our health. We're speaking with cardiologist Dr. Connelly about the connection between inflammation, obesity, and heart disease. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Dr. Connelly, thank you so much for being here with us.
Oh, thank you. Very grateful that you asked me to be with you today.
So, I'd like to start by having you explain what inflammation is and how it affects our bodies.
So, inflammation, I like to think about it two different ways, and this will help folks understand what we mean when we say inflammation. And the two different ways that I think about it is acute inflammation, and that means what happens now. And then there's chronic inflammation, which is what happens over a long time. And inflammation is our body's response to when it doesn't like something. The acute inflammation refers to when, let's say, you cut your hand and the bacteria got involved in it. We don't want that bacteria to enter into our body. So what does the body do? It has a response to that, and that response is called inflammation. And essentially what it is a whole lot of extra cells come in, surround that bacteria, and kill it. But what's happened is as we've survived, our bodies have moved beyond the acute inflammation to what we describe as chronic inflammation. And chronic inflammation is when those same cells, but at a much lower level, get activated. And what they do is they start to cause what I would refer to as sort of micro damage, tiny amounts of damage, because they were designed originally to kill the bacteria, but now they're not really killing the bacteria, and it actually starts to affect our own bodies. We now know that chronic inflammation can actually start to cause diseases. And one of the common diseases that it causes is what we describe to as coronary artery disease or atherosclerosis. That is, cholesterol gets into the arteries and starts to damage the arteries. And it's this chronic inflammation process that causes the damage that can then lead to heart disease, stroke, and all the other complications that we know of today.
So, what are some of the things that cause that chronic inflammation?
There's a number of things that we know can drive chronic inflammation, and when we think about them, they're mostly around the things that can actually cause heart disease. Smoking, for instance, can cause chronic inflammation. High cholesterol, diabetes both causes chronic inflammation, but can also result because of chronic inflammation. Obesity can also drive it. So folks who are living with obesity, and there's a number of different ways we can define that. And then also other things, sometimes folks are unfortunately born with a predisposition to chronic inflammation. And there are conditions that we call chronic inflammatory conditions that actually drive this chronic inflammatory process. And one of those that folks will know about is rheumatoid arthritis, which is a condition which affects the joints. Say, for instance, on my hand here, and that can actually cause a spillover effect throughout the whole body. And this is one of the reasons we actually learned that heart disease can be caused through chronic inflammation, because when we started looking at folks who had rheumatoid arthritis, we found that one of the reasons that they actually died was that they were more likely to have things like heart attacks and strokes.
So, from your rheumatoid arthritis example, it seems that the body interprets inflammation in the body as some kind of problem, something that it needs to attack, and that is why it can lead to greater heart disease?
Yeah, exactly. So exactly how this happens is an area of intense research at the moment. So why would this occur? And I think a lot of the reasons is that, yes, the body, if you think about it, we sort of evolved from cavemen and we didn't have modern society. And generally then, the biggest threats to me living, if I was a caveman, was actually getting an infection. And so the system was all set up to kill that infection. But then sometimes it gets it wrong. And it's when it gets it wrong that it then leads to this chronic inflammation. And in the setting of rheumatoid, the example we gave, the body says, I don't like that. I don't know what it is. I'm going to try to get rid of it. And it sends in those cells, which then cause chronic inflammation. And it's the same thing with cholesterol levels that build up in our body. The cholesterol levels build up and they get involved in the arterial walls. So the arteries actually get cholesterol in them. And the body says, I don't like that. Now it knows it's not a bacterial infection, but it doesn't really know what else to do with it. And so it says, I'm going to send in cells to get rid of it because it's probably a bad thing. And those cells come in and they cause that low-grade chronic inflammation. Now, unfortunately, when we think about cholesterol, you can't get rid of cholesterol. So the cholesterol's still there, but the cells have come in and they try to get rid of it and they can't. And now you've got a bit of this background low-grade inflammation. And then what happens over time is more cells come in to try and get rid of it. That causes more of the inflammation. That means more cholesterol can get in. And in that way, you can see when the process starts, instead of getting better, over time it will only get worse. And as a result, a lot of what we call chronic conditions that we see nowadays actually start off through this chronic inflammatory process.
So, does the body see obesity or excess weight as a similar threat? And is that why it leads to more inflammation as well?
When we think of folks who are living with obesity, there is no doubt, the data is very clear, that we see more chronic inflammation in those people, right? And we don't exactly understand the mechanisms as to why obesity is associated with chronic inflammation, but it is. And my best sort of analogy is this. Let's say you have a big meal and you're really full. You've eaten too much for Christmas dinner. So your belly's full and you sort of want to relax and you're comfortable. But you have to get on the subway to go down the road. Now, everyone else on the train has also had a very large meal and you're all crammed in there together. And it's sort of irritating. You get a little bit inflamed. You get a little bit angry. That process seems to be how the body responds with obesity. Okay, so we've eaten a bit too much. The fat cells actually enlarge. They push up against each other. They become angry. They become inflamed, like the example I gave from sitting on the subway, wherever you are. And that then causes this inflammatory response. And the inflammatory response is probably trying to settle it down, say, hey, everyone, let's all settle down. But of course, it can't do that. And so what happens is you have this grumbling, low-grade inflammation. And what that does is it actually causes the bodies to produce proteins, which can be designed to either make the inflammation more or actually make it less. So there's ones that are designed to turn it on and turn it off. But unfortunately, they're not effective at completely turning the process off. And in the process of the body trying to deal with those cells that are now engorged and enlarged, those proteins can actually start to damage other cells in the body. So you can see then how the link between that fat cell, which is now engorged, it then starts to influence other cells in the body. And in fact, one of the other cell types in the body that it can affect are the cells that line the arteries, and they are called endothelial cells. And we know that, in fact, some of those proteins that are produced damage the lining of the arteries. That can and then enable things like the cholesterol to get into the artery, and that's what starts this process of heart disease and stroke, and also disease of the legs, which we call peripheral arterial disease. And so there is a very clear link between obesity and this inflammatory response. And we're actually pretty good now at measuring this. There's a number of proteins that you can actually go and get measured if you go to your doctor to see how much inflammation is in the body. One of those is called CRP, and in fact, that is made by the liver. So when the liver senses there's inflammation, it puts this stuff out, and we can actually do a simple blood test to measure it. And there's a whole lot of other ones now that scientists and doctors can measure, because that's important. If we can then determine that there is a lot of inflammation going on, we can then start to think, okay, now we might have a treatment to reduce the inflammation. If we reduce the inflammation, we can then try to prevent the diseases that inflammation causes.
We're going to pause here and do our trivia question. If you answer our question tonight, folks, you'll get our collection of delicious and nutritious smoothie recipes for free. And that trivia question is, true or false, the heart beats approximately 100,000 times a day. Is that true or false? Does the heart beat approximately 100,000 times a day? Put your best guess in the comments and you'll get those smoothie recipes delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So, Dr. Connelly, does all body fat cause inflammation or just certain types, for example, belly fat or visceral fat?
If we think about where fat can be stored in our body, I like to think about it fairly simply. So it can be under the skin, right? If I take my wrist here, there's a bit of fat under the skin. That storage of fat does not seem to be associated with the chronic inflammation. That's not the sort of fat storage we're worried about. The one that we get mostly concerned about is the big belly. That is the sort of fat that sits around the organs in your tummy and sits around your tummy there. And that fat is the one that gets really angry. It becomes inflamed. And there's another source of fat that we also get worried about. I call that ectopic fat. And what that basically means is when the body doesn't know where to put the fat that you might have eaten in your meal, and it starts to put it in organs like the liver. And that can actually then cause this inflammation in the liver, which can then damage the liver. And in fact, we know now one of the commonest causes all around the world of liver failure is in fact the fat that gets into the liver causes this inflammation, which damages the liver and prevents it from working adequately. So yeah, where the fat goes is very important. Now, the good thing is it's fairly easy to measure that. You can have a look in the mirror, or we can put a tape measure around your tummy, or we can measure your weight and look at your height and figure out sort of roughly what it should be. But yeah, it's really important to understand that not all fat is the same.
So, keeping an eye on our belly fat is something that we really want to watch with our doctor over time because it's that fat increasing that can lead to problems down the road.
That is the type of fat that is a red flag. That's the one that's associated with heart disease, diabetes, strokes, and even other conditions such as inflammation can affect the brain.
Dr. Connelly, can having obesity and chronic inflammation make losing weight and keeping it off more difficult?
I think it's vexed us all as doctors for a long time because there was a theory for a long time that when you put on weight, it's because you ate the wrong food and you didn't exercise enough. And this whole inflammatory theory has shown that is completely wrong. Sure, there are folks who have eaten too much and haven't exercised, but in fact, for most people, that's actually not what happens. And what happens is when those cells start to become inflamed, they start to get angry, they change our metabolism. And when the metabolism changes, that's then what leads to more weight gain occurring. And that's a difficult process to actually turn off. So that's why we often see that when you put on weight, it's hard to get rid of it. Now, there's another very interesting thing that we've identified and discovered over the last few years. When fat cells stretch up, they like this. So what happens is when those fat cells swell up and they start to shrink down again, they actually send a signal to your brain and say, you're hungry, you're losing weight, you better go out and find more food. So it's not only just the metabolism that's changed, your body has a whole lot of signals to make certain that I'm always going out and I've got enough food for a rainy day. So now when you start to think about it like that, it's not surprising then that the old thoughts about how we put on weight are just completely wrong. And it also explains why when you put on a lot of weight, it is just so darn difficult to get rid of it, because it's actually your body telling you to go out and eat. And it's more complicated than that. It doesn't say go out and because you need to eat more, have an apple or a piece of celery. It says actually what we want is the foods that's going to have the highest fat content because maybe we're not going to have another meal. So it tells you to eat the burger and the fries and the other types of food. So it's a very, very complicated process. And that's why it's actually a great time to be around, because now we've moved beyond our theories, which were completely wrong. And as we've shifted, I think now we're actually going to come up with ways, and we have a number of new ways where we can actually help people lose weight and maintain the weight loss and protect the damage that they got from having the extra weight. So we can start to see we can protect the heart, we can protect the pancreas and stop diabetes or prevent diabetes. We can protect the brain from having a stroke.
So let's talk a little bit more about that, because that really is the good news. We do now have treatments that can really help people reach a healthier weight and stay there. Can reaching a healthier weight reduce inflammation?
Simple answer, yes. We do know there's a number of different ways that you can do it. We do know that there is diets, and in fact there's one diet called the Mediterranean diet, which sort of takes foods that you can imagine are growing around the Mediterranean. So lots of things like, tomatoes and beans and fish, and other healthy foods. You can have a little bit of meat, you can have a little bit of cheese, you can have a little bit of pasta if you're on the Italian side of the Mediterranean, but lots of fruit and vegetables and olive oil. So olive oil is one of these oils that has been shown to reduce inflammation. So I don't want people to think it's all about the drugs. No, diet itself does work. It just happens to take a long time. But in fact, there's been a number of studies to show that if you stick to that diet, you can help shrink those fat cells down and turn off the inflammation. So diet's a really important thing. And whenever we think of diet, we want to couple that with exercise. Now, we've also got more recent data showing that there are some newer drugs that we can use that will also help weight loss. And as the weight goes down, those inflammation proteins that we talk about, in particular that one C-reactive protein, falls quite dramatically as the weight falls off there. So yes, so the answer simply is yes, reducing the weight can reduce the inflammation, and you can do that with diet, exercise, and medications. But remember, because those fat cells get turned off, it's often for many people, diet and exercise alone won't be enough. Some people, absolutely it works, extremely effective. But for a lot of folks, and particularly if you're having trouble exercising, you might have arthritis, you might have other health issues, then we often do need to, what I say, kickstart the process, and you may need drugs in that particular situation.
So let's say that we are able to develop an obesity treatment plan with our physician. We are able to lose weight. We see that inflammation come down. Tell us all the good things that are going to be happening in the body with less inflammation. What diseases are we preventing? What's the good news here?
There is great news that reducing this inflammation and reducing weight protects the body. So if we think about what we call heart disease, that typically we think about heart attacks, strokes, and development of narrowing in the arteries in the legs, and we call that peripheral arterial disease. So as we reduce the inflammation, as we lose the weight, there is now data to show that we can protect and prevent strokes, heart attack, and narrowing in the arteries in the legs. There's also other data to show that in fact it prevents a condition called heart failure. And heart failure is where the heart just can't pump enough blood around as it needs to make certain that all the organs are functioning normally. And it's becoming a big problem, particularly in folks with diabetes. And we know that reducing the inflammation can prevent and protect against that. So that's one really good news story. Another really important area is diabetes. So at the moment, about 1 in 10 Canadians has a diagnosis of diabetes. And inflammation can both cause diabetes, because it really damages our metabolism, but it can also make diabetes worse and make diabetes cause more damage to our arteries, which can then lead to heart attacks and strokes and damage in the arteries in the legs and that peripheral arterial disease. And one fact that many people do not know, that in fact most people with diabetes unfortunately die of heart disease, about 2/3. And that could be a stroke, a heart attack, or amputations. The remaining third often get kidney disease. And if you develop kidney disease and end up on the dialysis machine, usually you die of a heart attack or a stroke. and the rest remaining percentage is usually things, unfortunately, cancer and infections. Now, there's also data as we move beyond the diabetes to show that, in fact, reducing inflammation can protect against cancer. When we get that fat in the liver and the liver becomes inflamed, it's now the number one cause of liver failure, which is a condition called cirrhosis. And we also know that obesity does other things we don't like. It can cause problems with the breathing when we sleep at night, a condition called obstructive sleep apnea, which also affects the heart. And of course, if we're carrying too much weight, what does it do to our joints? It causes premature arthritis. And arthritis is a huge problem and a very painful one. For anyone who's hurt a joint, you recognize if you're living with chronic pain because your joints have been worn down and damaged, this is a big, big problem there. So there's a link there: obesity, inflammation of the joints, damage to the joints, arthritis.
So, how much weight do we need to lose in order to see improvements in inflammation and improvements in all those other conditions you've mentioned?
It really depends on what you're looking for. So typically what we've said, and there's data now to support this, that if you want to stop someone dying from heart disease, heart failure, the liver disease that I've discussed before, very common causes of weight gain, leading to those conditions, you need to lose about 15% of your body weight. So let's say you're 100 kilos, 212 to 15 pounds, to give people an example. If you're losing around 15 kilos, so 25 to 30 pounds, that puts you in that area where you're going to actually live longer and do better. But if, for instance, you lose 10% of your body weight, that has important benefits on your joints. It's going to slow down the progression of arthritis. It's going to prevent that condition called sleep apnea, where you can't breathe effectively. Now, the more weight that you lose, the better it will be, but 10% seems to be a good mark at that. And with that, when we've studied it, we can see that often what happens, the blood pressure falls, the heart rate falls, those proteins that we measured of inflammation start to go down very nicely and fairly quickly as well. The checks for diabetes get better. The cholesterol gets better. We see lowering amounts of cholesterol in the bloodstream, and it's through those ways that we think it protects against the heart attack, the strokes, and the other conditions.
In case you're just joining us, we're here with Dr. Kim Connelly talking about obesity, inflammation, and heart health. And we're giving away an awesome collection of smoothie recipes if you answer our trivia question, which is, true or false, the heart beats approximately 100,000 times a day. Is that true or false? Does the heart beat about 100,000 times a day? Put your best guess in the comments, and you'll get those recipes delivered to your Facebook Messenger inbox for free. Folks, we do this show every month, and we want to make sure you never miss an episode. Like and follow us on Facebook to always see our updates. Dr. Connelly, what have we not discussed as it relates to obesity, inflammation, and heart disease that you think is really important for Canadians to know?
I think it's important that folks have that discussion with your doctor. As I said, there's a big change where in the past, if you were carrying too much weight, it was your problem. You've done something wrong. You've eaten too much. You haven't exercised. That's out. That's wrong. So the discussion needs to start with your doc. The good thing is there are new therapies that you can go after, and that's the conversation that I want people to have with their doctor. But it's always on the back of sticking to those advice around diet and exercise there. And of course, with that, we just want good health measures. We want to do this so that people sleep better. So have a look at your sleep. Are you getting your 6 or 7 or 8 hours a night? It's really important. You can't do these things if you're exhausted all the time. Making certain that you don't smoke. Smoking is a very, very strong risk factor for heart disease. There's no level of smoking that's safe. It's important that folks realize that they need to start this conversation about it. And ideally, the earlier we start it, the more we can prevent and protect against the heart disease. Now, on the flip side, folks out there will actually already have some degree of heart disease. It's really important that that is identified, and we have lots of different ways we can do that with different tests, either blood tests or scans of the heart or ultrasounds of the heart and the brain and so on, because we have many very effective, cheap and widely available therapies. So it's not only a matter of doing it to prevent, it's identifying a problem early and treating it so that you don't end up in the emergency department and have to see me. And unlike many other conditions, heart disease, for the most part, is very preventable. And one other fact I really want to throw out here while I'm giving my plug for heart disease, again, a lot of people do not know this. Women over the age of 70, the number one cause of dying is, in fact, heart disease. And again, a lot of that, through the reasons we've talked about, is potentially preventable.
Dr. Connelly, thank you so much for joining us tonight. This has been such an informative conversation.
Thank you. My pleasure. Always happy to talk about it.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false? The heart beats approximately 100,000 times a day. The answer is true. If you didn't get to answer the trivia question, but you'd still like those smoothie recipes, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.